So good evening, everyone, and welcome to our second of our In Conversations, which is live on Zoom this evening. Tonight we're joined by Makho. He's just come out of surgery, so he's just been doing exactly what most people on this live are looking for. So good evening to you. How are you doing? You okay?
I'm good, thanks, Mike. How are you? And how's everyone? Good evening.
I'm good, thank you. I am very good indeed, and I think we've got quite a few viewers on already. I know we've had quite a bit of interest on to discuss everything that we're going through. I think tonight is just an opportunity to discuss things in terms of you as a surgeon, what you do. I mean, I think most people know because that's why they're here, but you know, just what you do, what you specialise in, what they may need to have ready before surgery, before consultations, and just to go through a few different things really. So if you wouldn't mind, just start to introduce yourself and then we can get to know a bit about you.
Oh, brilliant. Thanks for that, Mike. And thanks for organizing this, because this is quite an important thing, because it's just part of engaging and forming partnership with our patients, and you know, so that we are able to answer their questions. And this is more like a relaxed platform, really, to just chat about things in general. So I hope our audience will find it useful. So my name is Makho. I'm a bariatric surgeon. Well, I'm a general surgeon, actually. So bariatric is more like a sub-specialization. Now, most of my patients find it difficult to pronounce my surname. So it is Mlotshwa. So Mlotshwa, that's how you say it. So you try and pronounce what you see. So that's what I always say. So if you see an M, try and sound it. If you see an L, try and sound it. But it's quite quick. It just goes Mlotshwa. But anyway, I'm very comfortable with everyone calling me Makho, and I think people have always known me as Makho.
Perfect. That's good to know.
Yeah, so I'm a full NHS consultant. So I practice in West Sussex. So my two hospitals where I practice is Worthing Hospital and St. Richard's Hospital. And obviously I'm an associate with Streamline. And most of our patients will know Streamline is well distributed in the south, starting from London. We are in Gifford, and Mike will remind me of other places. We have other places.
So we got, I know you're in Guildford, Marcus, so we do Portsmouth, the Spire in Portsmouth. We've got our Harrow location in North London. So there's many different locations. And I just want to pick up on your point as well about being NHS, because I really think that's a benefit of having you know, especially working in the NHS doing bariatric surgery, but doing it for us also as an associate surgeon. And I think a lot of people, that puts their mind at rest. So I really think that's a, you know, fantastic attribute that you bring, especially to Streamline as well. So yeah, and just as part of that, one of the questions really ties in is, what is your experience within bariatric, you know, bariatric surgery, and your background really?
Yes, I've been very lucky, and I think I always say quite privileged, because around West Sussex, I'm working with consultants whom I always proudly say they started bariatric. One of the first consultants who started bariatric surgery in the UK. So, you know, Shaw Somers, Mr. Slater, before King Edward was closed. That's why they started bariatric surgery. And I was just a senior house officer then. And you can imagine, I saw all the processes of how they looked after patient experiences, and them developing systems that protected patients, being involved in commissioning of bariatric to make it safe. And these were the days when they were still doing open surgery, Mike, when, you know, laparoscopic surgery was at its infancy. So I saw them really developing these pathways, you know, to make sure weight loss surgery was safe, you know, for our patients.
Yeah.
And they were involved even in developing the guidelines, the guidelines, which are now in the NICE guidelines. That's what directs us really in the UK.
Yeah.
And they were part of, those pioneers who were involved in actually being involved in looking at the research and
Yeah.
scrutinizing it and giving advice to say, right, if you are to start bariatric practice in a hospital, this is what you need. These are the loopholes and these are the guidelines, including obviously BMI thresholds. As you can imagine, because this is a serious undertaking, you can imagine someone, I may want to wear like a very nice suit and I think maybe I won't fit in that suit and I think bariatric surgery is for me. Because it's a serious undertaking, these consultants, these colleagues of mine were involved in developing, that criteria which makes sure these operations are safe for our patients. And one interesting thing, which I will tell you, Mike, which I saw them doing, they even involved the engineers. This is an interesting piece of thing. So they came to churches at St. Richard's, and this just shows how serious they were taking this. So they even had some engineers, obviously this is the hospital itself, to kind of look at our wards, look at our theaters, and make sure they can accommodate our patients with varied weights. And this is just the safety of the structure where the theaters are. If they are on first floor, is the ITU safe for that? Are the doors good enough so that they can fit a patient? Let's say there's an emergency or something like that.
Yeah.
So all I'm saying about this is I've seen the safety processes being developed by these colleagues of mine, which I'm proud now I'm working with. And actually, they trained me following that. From when they started, bariatric surgery, when
Yeah.
they moved laparoscopic surgery, and they were also involved in actually making sure that laparoscopic surgery was also safe. And they were involved in advising, like our partners in terms of the companies which develop equipment. So really that's kind of a brief of how I got involved in this. And obviously, when you get that attraction, that there are processes which are protecting patient, the patient is at the center of what these consultants are doing.
Yeah.
That's a very good environment to work in, because you can deliver care that is suitable for patient, that is tailored for a patient population, and more so that is safe.
Yeah, and I think that's a great point you've made. Especially a lot of people naively sometimes go into weight loss surgery and just think it's a procedure to have done to lose weight, but there is the element of care and the element of safety you've really got to be aware of. So it's a good point you make of the fact that you should take all this into consideration. The fact that we've been pioneers in making sure the surgeries are safe is only a good thing, really. And I'm sure, and I know that we're all as happy to have you on board as you are to be working with our colleagues. So yeah, no, 100%. Now, a question that's just come in, and I'm going to ask it purely because you've been in surgery today, so it's going to be fresh in your mind, is what happens on the day of the surgery?
Oh, very good. And the day of the surgery, I must say, is good that in Streamline, we have actually included that in our processes when we consult patients, that there is a section where we discuss that. So I'm happy to discuss that. So the important thing really is these patients come obvious. Our patients come when they've been thoroughly prepared by our dietitians, by our administrators, by our specialist personnel, in Streamline. So when they come on the day of surgery, they know exactly what they're expected to do. So they come nil by mouth. They've started their multivitamins. They bring their machine, like let's say if they have obstructive sleep apnea. So they are well prepared. So on the day of the surgery, they arrive in the morning, and that's when obviously they are welcomed in our hospitals, various hospitals, be it in London, be it in Guildford, be it in Portsmouth. They are welcomed by our partners. We have formed partners with these private hospitals. So the nurses there, they have much understanding of bariatric surgery. They know the sensitivities of our work, and they know how to look after our patients. So obviously they'll do all the checklist, which makes sure that the patient is safe and they know exactly what patients are allergic to. And they'll meet a surgeon around about 8 o'clock. So this is a surgeon, obviously, whom they've seen previous in the consultations. And this journey, obviously, has started already. So the surgeon is just meeting them at 8 o'clock. And this is just really to check if they are well, how they are feeling, how have they been doing on the meal diet, because that's important, really. Because before you operate on anyone, you have to actually just check their well-being. How have they been in the last week? And many times you actually discover that someone tells you, actually, I had COVID 2 weeks ago. And then you actually discover, okay, right, we didn't know that maybe it's not safe to proceed. So it's important to have that conversation in the morning, just checking how the patient is. And that day of surgery, the main important thing is the consenting process, which obviously checking that the patient whom you're coming to operate on, what operation are they having? Not because we don't know, but it's just to make sure that you are doing the right operation for that patient. You can come, it has happened before, we've read it in newspapers, that a patient came for a bariatric operation and ended up having a gallbladder. It has never happened with us, God forbid. Never happened. But we check exactly with the patient to say, this is how I started myself. I say, not because I don't know. Can you tell me which operation we are doing for you? And the patient will say, gastric bypass. And then I say, all right, I have the right information as well. We are doing a gastric bypass. And then we start from there. And then that process really is more like finding the understanding of my patient from the initial consultation and the follow-up consultation with our team, because we are a team, really. That's important. There are dietitians, there are lots of things which are said. And so it's just checking that information, that they understand exactly what they are putting themselves into. And most of the time our patients are happy because they have enough information before they come to surgery. So it's just talking about the risk and potential, I would say potential complications, because we know that weight loss surgery is safe. We know that for certain. So it's just potential complications to give patients, that picture of that, well, there are potential complications like infection, bleeding, and other potential complications. And then we give our patients on the day of the surgery to ask questions, to ask all the questions, because the consenting process now, while you're a doctor, you think like, oh, I'm talking about how the operation is going to be done. These are the complications. There are simple little things which we ignore, which are very important to our patients. For example, a patient will tell you to say, right, so now, can I just find out if it's safe for me to fly after 3 weeks? And then obviously, you wouldn't have thought about that.
Yeah.
And there are other things which we assume that patients, they will ask you to say, right, so when I'm in surgery, will I be awake? Am I asleep? Or, and things, and this is important because you are trying to really um, get this person at ease and understand that what we do is safe. And when they've asked all the questions, we are able to get them to sign a consent form. And then obviously there's an anesthetist as well who comes to talk to them. And then we tell them what time they'll be going to theater, roughly, because oftentimes you can imagine you start with one patient initially in the morning, and surgery is variable. We may think it will take just 1 hour, but sometimes depending on the difficulty or the challenges in there, because the important thing is to make sure when you get to the end of the operation is safe. So there's no time limit to it. So we are very careful with that. So we have to reassure our patients as well that we apologize that if there is a delay, you will certainly be done. So it's more like putting our patients at ease. So that's in brief what happens on the day of the operation.
And yeah, perfect. I mean, like you say, I think because of the consultation that goes ahead beforehand, especially with the initial consultation with yourself, patients are so often, you know, so well informed that they could probably write a book about bariatric surgery before they've had it. And that's it. And just touching on, I know that there's consultations with dietitians and sometimes maybe a psychologist, you know, through different routes. But what does the initial, you know, consultation, I'm going to put a few questions in one here, is, you know, what is discussed in an initial consultation? And how do I know that I'll be suitable for surgery? And also, how do I know which surgery is right for me?
Excellent. So really, I've mentioned some of the things which happen during the consultation. It's just knowing about our patient, you know, like tell me about yourself. And also, because weight loss surgery is a journey, our patients have very beautiful stories going back how much effort they've put into trying to lose weight over years, and the medical conditions which have ended up impacting on their lives. So you want to just listen to them first. And while you're listening to them, you get the demographics, the age of our patients. We check their date of birth. We check where they live because that's relevant. Because obviously we pride in following up our patients. And when I say follow up, I mean immediately after the operation, because they may call me like after 3 days saying, I'm having this problem. So we need to know where our patients are and know where to direct them to get some help. So that demographic is really important. We get their phone numbers, interesting enough. So we keep that data. And obviously, we have consented them for that. And we listen to them, their struggles with weight loss, and that includes when it started. And they actually tell us exactly what they think has contributed to their weight issues. They'll tell you, oh, maybe I think it's large portions, I think it's takeaways. And some they'll tell you like really stories which date back from when they were young, which includes a lot of mental health issues. And so we pay attention to that because that will mean we can tailor the operation to suit that person. So we'll listen to that, what has contributed to their weight issues. We ask about eating habits. We ask about snacking in between meals. We check if they're emotional eater or compulsive eater, because obviously our partners, our team, we have teams which pick on this information and actually prepare our patients for a safe operation based on that information. And then we just check their past medical history as well. Do they have diabetes? Do they have osteoarthritis? And medications? Do they have allergies? Do they smoke or drink? Which is important, obviously, because we know that patients who smoke, there is a problem in terms of just wound healing. Some develop some stomach ulcers and all that. So that information is important to capture. their relationship to sweets, fizzy drinks, alcohol, so that our teams can actually pick on that and prepare them for surgery. And then once we have got all that information, then we ask them to say, obviously, our patients are well researched. That's what I've found, Mike. They're so well researched.
Yeah.
They know a lot of stuff. So you ask them to say, what were you thinking? Which operations have you researched on? And they'll tell you all the information. And why I'm asking that question is so that I can tailor the information they have given me in terms of their relationship to food to which operation is appropriate for them.
Yeah.
So I think I'm answering maybe the second question to say
Yeah.
it's not like one size fits all. So
Yeah,
that
exactly.
information, absolutely, that information which we take during the consultation is the information which, despite what the patient has given me in terms of their research, I'll say, obviously, most of the time they're quite accurate, I must say. And then you are filling in, showing them tiny information to say, right, currently at the age of 25, the research that is there is seemingly showing that sleeve is a less aggressive operation compared to a bypass for you, because you are tailoring
Yeah.
to that person, because you are looking at their age and saying they still have a long way. And if they are ladies, they'll get to an age where they are having the childbearing age. And we know that with pregnancy, there are micronutrient issues, and you have to cater for that and say, right, if I give them a sleeve, I think that's a safe option for that patient.
Yeah.
So it's just answering that question, that all that information is to tailor and find the right operation for our patients. So at the end of the day, it's a consensus between myself and my patient, and we literally agree. And even I say, what do you think? They say, do you know what? With the information which we have discussed, I think I would like a sleeve or I like a bypass. Then I say, actually, I agree with you. I would recommend a bypass or a sleeve.
Yeah. And
Yeah.
also, I've got a question here in relation to that. If somebody has their heart on one operation, but you wholeheartedly believe that it's not right for them, would you advise them on that? Because we've got a question here from somebody that wants to remain anonymous, but they're
Yes.
worried that they may not be making the right choice, and they need somebody to guide them more so, because they're worried about different complications and different things like that, and they want to know whether you will give them an honest opinion on what's right for them if they had a consultation with yourself. Is that something that you would do?
Absolutely. I think that's a very good question, Mike, and it's a very important question. I think that question answers itself as well.
Yeah.
So when we this team, like a team at Streamline, because we have a robust system of an MDT, we have a team which actually checks all this information, and we advise each other. And to a certain extent, you call me and say, Makho, I was talking to that patient we consulted that day. She has mentioned this thing. What do you think about that? And then I'll revisit that consultation and talk to my colleagues, whether it's the dietitian or another consultant colleague. Say, no, there's this information Mike has given me about our patient. So really what I'm trying to say is we'll be absolutely honest with our patient, despite what operation they feel is the right operation for them, to give them medical literature for them to have a choice.
Yeah.
And invariable, I must say, from in my experience, every time you have done it that way, and we have involved our multiple teams, we always come to a consensus with our patient to say, actually, do you know, I think a bypass is the right operation for me, all the anxieties which I had about the bypass, you have answered those questions. The dietitians have answered that question.
Yeah.
And I feel comfortable to go that direction. So we are always absolutely honest with our patients, absolutely honest with our patients.
And I'd completely agree with you as well, Marco. The thing is, patients on their journey, they do change which operation they think's right. I'll speak to someone initially and they say, I definitely want a band. And then it comes to light that it's not right for them. And then at the surgery, they're having a bypass, and that is completely the right thing. And I think everyone in Streamline, we would not go ahead with an operation, especially here, if we don't feel that everyone's on the same page. And I don't think I've ever experienced in the time I've been here that anyone's been unhappy with the choice that they've made, because they do get that support and the consultation and the dietetic appointments. So yeah, I think you are 100% completely right. And what you're saying to me in practice works as well, because I hear it from the patients all the time. I hear after the initial consultations, I was thinking about a band, but I spoke to Marco and he's now recommended this, and I actually think he's right. And then they go for surgery, and you speak to them a year down the line, and they absolutely are really happy with what they had. So it is really important to listen, to the patient, as you said, but I think the patients need to understand it's really important to listen to the surgeon as well, because especially from my point of view as being a patient previously, you do have to listen to what your surgeon says, because they are the expert at the end of the day. I wouldn't go and take my car for an MOT and tell them it doesn't need new brakes when I get told it needs new brakes. So I think it is important to listen in relation to that. So yeah, 100%. Now, a few questions we've got here as well for you, Marco. There's a few different things about the procedures in general. So so we've got questions about what is the recovery process like and how long will it take to recover? Are the procedures reversible, and how long will I be in surgery for the procedures that you offer?
Okay, brilliant. Thanks, Mike, for that. So we have like a varied range of operations. You remember you described this very well, that bariatrics is like a journey, really. So we have a varied number of operations, and I'll just describe them briefly so that our audience, I'm sure they know some of this information. So our operations, we call them restrictive, which means obviously it restricts how much you can eat. We call them malabsorptive, or a combination of the two. So an operation like a gastric band is restrictive. An operation like a gastric bypass, a combination of the two, is restrictive because you have a tiny stomach, which we say is as big as a thumb. And then obviously that's restricting. And then you're bypassing a certain section of the small intestine where you will absorb nutrients and absorb proteins and all that. So you can say that's malabsorptive in a way, and that makes you lose weight. But of course, we know the mechanism is much complex than that. It's a hormonal mechanism. So all these operations, when we take someone to theater, a gastric band specifically, it will last anything up to an hour and a half. But the important thing to emphasize there is not the time it takes you in theater, it's you having a safe operation. I'm saying that because when you start training in surgery as a registrar or a junior surgeon, there's this competition to say maybe an operation should happen fast, so that I finish quick. And you hear people saying, oh, so and so does this operation in 30 minutes, in 40 minutes.
Yeah.
So timing doesn't mean that you have had a safe operation. The important thing is safety. So you can imagine at Streamline, I think we are very proud that we try to make operations as safe as possible.
Yeah.
And no restriction in time as such. But of course, with the learning curves, we know that a band will take about up to an hour or an hour, 15 minutes. A sleeve, an hour to an hour, 15 minutes or 30 minutes. bypass, same up to 2 hours. But obviously the complexities depend whether a patient has had a previous operation where they have adhesions. Everyone is different. That's the other thing. Our body habitus is different. Whether you see someone with a low BMI or a high BMI, you may discover someone with a BMI 30, their operation takes longer than someone with a BMI 60. So we are all different. So when we say that timing, how much you spend in theater, it doesn't apply to everybody. So everyone is different. The important message is we make sure we give you a safe operation no matter how long it takes. I think that's the message which I'll give about how long it will take. The other question which you asked, Mike, just remind me, please.
So the procedure's reversible, and also how long the recovery process is.
Oh, brilliant. I'll talk about recovery since I've just mentioned the operations. So our patients have an inpatient stay of anything between 1 day to 2 days. Now, most of us, we prefer to observe our patients for 2 days. And what are we doing by that? We are just checking their observations. We are checking their blood test. We are checking their alimentation, that they can drink water safely, that they can be able to swallow, like nutritionally, because we're already thinking we have done an operation, we want to make sure that operation is safe, the patient is still going to maintain nutrition. So that's important. So those 2 days are vital in that we make those assessments. And you can actually tell the projection how a patient is going to recover. And more so, that's when we pick if there are any immediate complications, which I must say they're very rare. They're very rare. But that time, that's when we pick immediate complications. So we discharge our patients on day 2. And most of our patients, we encourage them to start mobilizing, and they are mobilizing already in those 2 days. And we emphasize on that because we know that the pain associated with keyhole surgery, because we blow up their tummy with gas, it causes some irritation of your shoulders because it irritates the diaphragm. And the feedback which we get from our patients, when they start mobilizing, they feel better. The pain is better. So our patients start mobilizing right away within that 48 hours. And then we encourage them to mobilize in the next weeks or so when they are home. And that is important because we want to stop them having stasis in their legs, which might cause thrombosis. And of course, they are discharged on injections, which also help in that. But part of the recovery is encouraging them to mobilize. We encourage them to be off work for 2 weeks. Majority of our patients don't go work for 2 weeks, and it's variable. Each patient has their own circumstances, which may end up leading them being off work for 3 weeks, 4 weeks. So we cater from that. And where does that come from? It comes from that engagement, which I mentioned, initial consultation, the other consultations that follow. So that time is variable from patient to patient. Some of our patients ask us, say, when can I swim? When can I start going to the gym? Now, most of our patients who start doing swimming, not competitive swimming, within 3 weeks to 4 weeks, if it's safe to do so. And the good thing is, most of our patients, they are sensible about these things. We tell them that you are a sensible person, listen to your body, what is allowing you to do. And most of our patients are so sensible, Mike. We've never had problems where someone ended up doing something. So, oh, you said I can swim within 3 weeks. Most of them, they are absolutely fine with that. I think you will agree with me when I say that.
Yeah, 100%. 100%. And I think everybody knows that, you know, either had a surgery before. You've got to listen to your body. There's no point going and lifting heavy weights just because you think you can. That time will come. You know, the time initially after surgery is so important, just to look after yourself and to make sure that you're well in general. You know, there's time for that. You know, there's a time for going to the gym. There's a time for going for, you know, if you do want to get into competitive swimming, there's a time for that. And I think everyone, like you say, I think everyone is sensible enough that comes to us to know that, you know, you've got to be reasonable. You've got to listen to your body to make sure that your recovery goes as well as it can. So I think if you don't listen to your body, you're not going to have a successful recovery.
Absolutely. Absolutely. Are these operations reversible? Now, right from the onset, when we talk to our patients and we engage in the initial consultation, it's important, obviously, we say this is a journey. It's important to emphasize that this is a major lifestyle decision. And we know our patients, most of the time, they don't take it lightly, because the emphasis is these operations are a permanent solution to weight issues, including medical condition. And we know they can reverse diabetes, they can reverse hypertension. And most of our patients, these operations, they are for life. This is the main point, really, which I will say. They are for life because it keeps their medical conditions in remission. And more so, it gives them that longevity, because we know that with their weight issues and these medical conditions, the patients don't live to see their grandkids or their grandchildren, you know, things which they wanted to enjoy in their retirement. They may not see that because of obesity. And that's why they come to Streamline to ask us to help them. So these operations, they are a permanent solution to those problems. Now, having said that, because we know that obviously any treatment, some treatment may not work for some individuals. The same medication, there's someone who will tell you that paracetamol doesn't work for me, and actually it doesn't work for them.
Yeah.
And it means obviously you can't give them paracetamol, you have to give them. So all I'm trying to say, if you look at this operation like any other treatment, there are some patients, the operation may not work for them. Not because the operation was not done properly, but because the human body is quite complicated. It reacts differently to everything, whether it's food, it reacts different to medications, it reacts different to so many things. Or even that operation, if you take it, that operation is treatment. Some patients, and this is not the majority, it's very rare that we come across that, where a patient has suffered maybe nutritionally, and despite our best effort with our experienced dietitians who have experience with all these nutritional issues, you find that patient is not getting better. They start having complications, including sometimes liver issues and all that. And this is very rare, Mike. This is very rare.
Yeah.
So that patient, we go back to our multiple disciplinary team meeting of experts, and we sit down to discuss that patient to say, what are the options here? And obviously that involves the patient themselves. So that is when in rare circumstances, we have to reverse operations like a gastric bypass. Now, other circumstances in life, obviously, because of other medical conditions, the patient can end up suffering a medical conditions, which obviously makes that patient need the vital nutrition, which is affected by an operation. So in that case, then we will say, look, we need to remove that band because of that.
Yeah.
So these are in rare circumstances. So to answer that question in short, these operations, they are meant to be permanent because they are part of you. They'll look after you. They'll keep your diabetes in remission. But in rare circumstances, yes, we go back to the drawing board in partnership with the patient. With our multiple professional teams, we look at a case by case, and it's very rare that we end up concluding that we have to do a reversal.
Yeah. And I think that's important what you just mentioned as well, because it is important to mention, you know, the very, very small minority of people that may have a complication, which means they need to be brought back to the MDT team and discuss what, because I've got a question about going abroad. I think that really is a main factor in why you should choose, not just as a Streamline, but a UK-based provider, because you've got that support, you've got that constant, you know, channel of communication, and you've got that reassurance. So I think you've answered that question about going abroad as well. Just that's the difference, really, isn't it?
Absolutely, absolutely, Mike.
Now we've got a couple more questions here as well, about a few different things. We've got someone here that smokes, and they want to know how smoking will affect their surgery and post-surgery, and do I need to stop smoking before surgery?
Oh, very good. That's a good question. So you can imagine when we talk to our patient, we deal with all varied range of patients. So some smoke, and there are reasons why patients smoke. That's a lifestyle. And they'll tell you all the reasons why they've ended up being like that. Now, but obviously, we know that smoking, number one, it does affect the lung. Now, for our operations to work, it's important that they are safe. And part of the safety is that when we put them to sleep to do these operations, the anesthetic is as safe as it can be. So smoking will affect the lung, and the anesthetist will tell you that it's very difficult to ventilate patients with varied problems resulting in their lung being stiff due to smoking.
Right.
And more so, they run a risk of getting things like pneumonias after an operation or just some chest infections. And these chest infections can affect healing because you are not oxygenating yourself very well. And these operations are delicate because, one, there is a joint which needs to heal within a certain stipulated time. And when you smoke, we know that the blood supply to that vital place where we want blood to be will be affected by smoking. So that's why we emphasize to our patients that is vital that they stop smoking well before an operation. And I must say, the majority of our patients, because already after talking to our multiple professional teams, they get that message clearly because already they are so motivated, Mike, to get their health back on check. We never have problems with some of them. Yep. They start telling you, do you know what? Since I started talking to you guys, it gave me the motivation to stop smoking, and I have stopped smoking. So it's very rare that we have that problem because of that consultation and that robust teams which actually look at all these entities. Now, yeah, yes, thanks, Mike. Yeah, you can.
No, I was just saying that I think that because when somebody's made a decision to have surgery, I think it focuses the mind, doesn't it? So it's like, you know, they've got to do everything they can to make sure that it's safe. And I think everybody who has ever considered surgery of any kind knows there are some risks. And I think the thing you want to do with surgery is to make sure that you sort of eradicate them as best you can. So it's not surprising, I don't think, that people just think, you know, focus the mind, let's stop the smoking, let's get on, you know, a healthier path, really.
Absolutely, absolutely. The other thing which I always say to my patients, you remember those adverts about smoking, which are really, you know, I remember most people say, oh, that advert just is so revolting. When they show like a smoker a blood vessel like oozing some cholesterol or
Yeah.
some. Remember that advert?
Yeah, I know
So,
which one you mean.
and I know it's quite dramatic, but from a bariatric point of view, especially after a bypass, um, in the long term, and these are patients who continue to smoke or vape, because vaping, sometimes some vapes have nicotine. In the long term, after 3 years or 5 years, some of these patients have presented to hospital with literally, Mike, a perforation of an ulcer in their small stomach or in that joint. And when you see it, when you take patients back to theater for that, the patients maybe who have
Yeah.
been smoking or continue
Mhm.
to smoke. And when you see it, like how dramatic that perforation is, literally, you find a hole in the joint or in the
Yeah.
stomach or in the first part of the intestine. And it always reminds me of that advert that, well, this ulcer is so dramatic. And when you look back, you know that is a result of smoking because you don't see it in patients who don't smoke.
Right.
But as you say, most of our patients, after going through our multiple professional teams, and because already they are so motivated to change their lifestyle, smoking is never a problem. Most of them, they tell you, do you know what? I've thought about this. I'm not smoking anymore.
Yeah.
So which is great, really.
Yeah, so it is a benefit, and it's for safety, really, like you say, isn't it? So, if the person who's asked the question is thinking about surgery, think about your intake and maybe cut down, because it's not easy, but try and cut down as much as you can to a level where you can stop, really. So we've got two more questions for you, and I'll let you go. So you've had a long day in surgery as well. So let's have a look. I'm just going to check the ones that come in. Yeah, we've got one that's coming as well. I'll answer that as well because it's almost exactly the same to what we've got. Got one here that says, will I be able to get pregnant after weight loss surgery? And the question we had live was about how soon after surgery is pregnancy an option?
Excellent. Thanks for that question, Mike. I'll try and answer it in many parts. And just going back to the consultation, we get some of our patients coming to consult us because they can't conceive. And why can they conceive? Because they've been diagnosed with polycystic ovary syndrome. And obviously, there is an imbalance in their hormones, and obesity has an impact on that. And through hormonal mechanism that they can't have ovulatory cycles and therefore they can't conceive. So they have been referred by their gynecologist to say, can you consider weight loss surgery? And these patients, mind you, I have to emphasize this, they've tried everything. They've tried
Yeah.
calorie counting, they've tried slimming well, they've tried everything. They lose a bit of weight, they gain that weight back again. And we know that there's evidence that weight loss surgery certainly improve these hormones which are responsible for ovulatory cycles, and our patients can conceive again following these operations. So that's one section. Another section, some patients for various reasons they've not managed to have children, and they are considering in vitro fertilization or other forms of trying to have children. And because their BMI cut off for them to be considered for that, they have been referred to us to give them weight loss surgery so that they can have successful IVF. And we have managed to recommend certain operations for that as well. Now, the important thing there to say, all our patients following our operations, we encourage them not to conceive between 12 months to 18 months. So at least they should not conceive between 12 months to 18 months. And the reason is because in the first 12 months after surgery, this is the maximum time when you are losing weight. And that time, obviously, if you conceive, there may be some nutritional issues which may impact on your baby in terms of the health of your child. And as well, because we know that childbearing is a very sensitive issue, you have to get the micronutrients right. There are lots of checks which are done to make sure that your vitamin B12, your folate is quite right. We don't want to jeopardize that in that first 12 months when patients are having maximum weight loss. So that's the reason why we advise no conception during that time. And if patients have conceived, we know that there is literature which actually show that they may get miscarriage, they may get small gestational age children. So obvious because of that, we advise them no conceiving within 12 to 18 months. Now, and the thing which I will say as well, which is important for um, women of childbearing, there is evidence certainly that, let's say you conceive whilst you have a weight issue like your BMI is about 39. We know that's associated with side effects as far as complications with your child, your unborn child, gestational diabetes during pregnancy, which causes eclampsia and all that.
Yeah.
Diabetes, which is difficult to treat. Hypertension, which is difficult to treat in pregnancy. So when you consider weight loss surgery, even at an early age, if let's say someone who has failed to lose weight, you know there are benefits of that in the long term. So I hope that answers that question.
Yeah, no, 100%. And like you say, at least it gives the person that's asked about the timelines, how long they can expect. And, you know, yes. one of the sometimes people say to me, well, I want to you know, finalize my family, and I want to make sure I've got a family within the next year. And sometimes I say to them, if you are considering, you know, having another child within the next year, maybe complete your family and then come back to us for weight loss surgery afterwards. If it's not to help you conceive, if you've had children, you've conceived before and everything was fine, maybe consider whether weight loss surgery is right for you after you've completed your family. So then that's always a good consideration to have as well.
Absolutely. You bring a very important point there, Mike. That's a very important point.
So yeah, and like you say, it's different for everybody. So it's always good to have that conversation because you'll give your honest opinion as well. Now, one thing that someone's asked, and this is our final question for you, Makho, that would be great, is what advice would you give to someone who is interested in surgery but not sure where to start?
That's a very good one. That's a very good one. So I think throughout our discussion, we have mentioned this from the initial consultation, that the important thing is to check exactly what the aims are and what this patient's problems have been with weight issues. How did they start their relationship? You know, that history which you take from the patient. So even if they don't know what operation they should have, so based on that history which I've taken, and based on our multi-professional team, which actually, when someone is not sure, we'll talk to our dietitian, we'll talk to our specialist nurses, we'll talk to the first person actually who picks the phone when they call Streamline to say, oh, I'm considering weight loss surgery. They actually discover that they get information right from the onset. So it's very rare that when they get to the end of these multi-professional teams, that they have not come to a consensus to say, based on what I've the information I've got from Streamline, I know what I want, and I think I know this is the right thing to do. So that's my experience to answer that question, Mike.
Yeah, no, perfect. And like you say, have a consultation. They're completely, free for patients to come and have a consultation. One of the benefits as well is that it's a conversation like this over Zoom, your initial consultation. So it doesn't matter where you're based. You may be operating out of Guildford, but you can have the conversations sort of, from your armchair, really. So, if people are looking forward to, have bariatric surgery, come and take advantage of a consultation, because I'm sure you'll be happy to answer every question that they've got. And like I said, we've got, consultation dates in the next couple of weeks. And if people are watching this now and wanting to book in, I would, 100% recommend that they do that.
Brilliant, Mike. Absolutely.
I'm just going to check, Marco, because I think we've answered. Yeah, we have. So we've answered everything that people have wanted answering. I've learned an awful lot as well that I didn't know. So I'm going to thank you for that as well, because I had no idea about some of the things you've discussed. So it's really interesting to find that out. And just thank you for joining us, really, Marco.
And thank you, Mike. Thanks for organizing this, and thanks for everyone who participated and all the questions. And actually, these questions are important because they give you some feedback as well. So my next consultation, I have learned something out of this. I'll say, oh, I need to discuss this. So this is really important for us as well.
No, I'm glad as well, Makho. Well, I'm going to let you get off. I'm going to say thank you for joining us. Thank you to all the audience as well. And if we don't see you again before Christmas on a live, the audience, yourself, Makho, have a great festive period as well.
Thank you very much. And same to you, Mike, and same to everyone, please.
Oh, thanks, Makho. It's been lovely speaking to you.
Bye-bye. Have a good evening. Bye now.